So why is it that you've seen two different rheumatologists? One thinks you don't have an inflammatory condition, one thinks you do. How does that happen, and what do you make of that? This is Dr. Siddharth Damber, expert in rheumatology and regenerative medicine here at Chicago Arthritis. So, case example today, saw a patient today who came in with, it's a young woman who has a history of various migrating pains, had seen another rheumatologist in the past. She was ANA positive, has a family history of lupus. She has an interesting history, sounds suspicious for inflammatory arthritis, was seen by this other rheumatologist, had a very full workup in terms of antibodies that all came back negative, a lot of x-rays that were done that looked okay as well, was tried on prednisone, had about a 60% degree of pain relief, so partially steroid responsive. Her first rheumatologist felt like she did not have inflammatory arthritis. My evaluation of her today, I came to a slightly different opinion where I think she actually does have early inflammatory arthritis. So how does this happen? To begin with, it's not uncommon that rheumatologists can have differing opinions. The vast majority of times, if somebody has an inflammatory arthritis or autoimmune condition, rheumatologists will generally agree. And the reason why is because there are some very defined and set criteria for these various autoimmune conditions. And if you meet criteria, you'll be diagnosed, likely not just by one rheumatologist, but by other rheumatologists as well. In this case, a little something is different. So there are cases where people may not meet exact criteria. So in this individual's case, she's ANA positive, her additional antibodies came back negative. That's really not enough to say someone does not have an autoimmune condition if you find other objective findings. So, with her first rheumatology opinion, the additional x-rays were negative, labs were negative. I don't have their notes, but presumably, perhaps examination was negative as well. From their perspective, they felt like not consistent with inflammatory arthritis. My evaluation today was a little bit different. On her exam, a little bit of swelling on her left wrist. More importantly, on ultrasound, done in the clinic, she has definite fluid in her right wrist. To me, that is good enough. Her combination of her symptoms, family history, one positive antibody, some examination findings, and an ultrasound finding to say that, yes, I do think you have an inflammatory arthritis. So to begin with, there's definitely a difference in terms of what we're objectively seeing in terms of examination. It is possible that a patient may have a little bit more inflammation in joints on one day and not as much on another day. That may have been one difference. To me, the bigger difference, however, was probably that I did look at her joints under ultrasound today. When it comes to inflammatory arthritis, your rheumatologist should be utilizing ultrasound, diagnostic musculoskeletal ultrasound, if they're looking at your peripheral joints and tendons. That means in your arms and your legs. Ultrasound has less applicability or access to look at the joints or inflammation in the spine, but in the arms and the legs, really important to utilize ultrasound. So I think that was another big difference here, meaning utilizing a tool that perhaps the other rheumatologists did not use to help firmly diagnose this individual with inflammatory arthritis. Now, obviously, this will lead to dramatically different treatment algorithm, and I think will make a big difference in this individual's life long term. But when you see cases where rheumatologists have different opinions, it could be because maybe catching it on a different day, but a lot of times it is also because it's possible one rheumatologist may be utilizing and looking at a slightly extra set of tools that may be giving them a little bit more ideas and perspective in terms of what's going on with your condition. If you found this helpful, give us a like, subscribe. Until we connect again, I hope everyone has a good day and lives well. Bye-bye.